First off, I would like to present to you a specific topic that is dear on my heart because this is the latest project I'm coordinating for UNODC, and it's one of the best projects in terms of all the list of assignments I've been taking. I'm enjoying for more than one reason. I'm going to talk about family skills and the powerful impact families could have in preventing drug use and other negative social outcomes. The outset, the flags that you see are the flags that are supporting Project JLOK01, which is the code for the global projects I'm referring to. But I would like to draw the attention most specifically because this project has several outcomes on prevention. On the family skills front, France, Germany, Japan, Saudi Arabia, Spain, Sweden, the USINL are our main contributor that I would like to acknowledge. The first question is, why families? Well, the two most powerful social institutions that exist for prevention purposes that first come to mind are the school and the family. The only difference between schools and family is that if we look from families from an analogy of a school, the ratio of teacher to students is much smaller, so you have a more dose effect impact there. The other thing is, unlike a school that you have a one-year intervention with that teacher, you have a longer-term commitment between the people of that institution. And the other thing that these people within the family share genes, share a history, and share a future. So, like school could be impactful, and of course programs can be impactful in school, we can imagine how strong this social institution that is the family could have if it's armed with the appropriate tools it could have. So I'm a statistician and epidemiologist. I'm not a preventologist from the sense of I design programs and I implement programs to assess their impact. So inspired by the presentation of my mentor, even I haven't seen him in person until today, Professor Callum, on the occasion of the 100-year anniversary of Johns Hopkins, I brushed up my dissertation thesis that I've done. And most importantly, because one of my thesis advisors, who happens to be the wife of Professor Callum, Professor Ensminger, sitting there, was on my thesis committee, I thought I'll show you the data that I worked on that made me more inspired in terms of why should I be working with families. So to start with, first of all, I have to give a disclaimer that I had to do lots of bells and whistles in terms of sophisticated statistical analysis to impress my thesis committee that I'm going to tone down a lot during my presentation and focus on the crux of it because I already passed my dissertation. And I'll tell you what kind of sample I worked with. So the National Longitudinal Survey of Youth is started in 1979 in the United States, and the purpose of it is to monitor the drug working force, the labor working force cohort within the US, starting from 1979 on a yearly basis, to assess what kind of problems, economic, social, health issues they would have from that perspective. And it was a cohort of about 13,000 people that are nationally representative of the United States, were followed every single year since 1979. By the time they entered, they were 14 and on. They're going into the workforce. In that cohort, there were 6,300 women. The reason I'm focusing on these women is because it so happened that this specific cohort, the women of this cohort, every single woman that was part of the cohort that had a baby, their baby were part of a second generation cohort that were followed from birth onward as well. So there were 6,300 women in that cohort. Around 5,000 of them became mothers. And around 1,700 of these mothers had children that were about the age of 15 by 2004. And I imagine by 15 and on, I can start looking into substance use in that second generation. So any mother that had kids that are 15, at least 15 by 2004, is a mother that I would like to take as generation one in my cohort. And there were about 1,700 mothers. Again, the second generation, even though I had about 12,000 kids to work with, there were 8,000 kids that were aged 15 by 2004, which is a really good generation cohort. And then some of them were followed, and I waited until they were followed from 15 until at least they're 21. So I had about 4,500 kids, 1,700 mothers, 4,500 kids. I have data on the mothers before they became mothers. I have data on the kids, from the day they were born onward. I was like, let's play around with this data and see what I can get. This is a really wealthy data source of information to see what could happen. So I was looking in terms of mothers who uses drugs and kids that use drugs within this family, and how much there is correlation between the two measures. If a parent is a substance user, the kid will be a substance user. In my generation one, I had 39% of my sample that used marijuana at least once in their life. I looked at the substance that is most commonly used as an illicit substance. That's why I focused on marijuana. I wanted a big sample. And in generation two, between the ages of 15 and 21, in my generation two, 33% of that sample already have used marijuana. So I had a pretty decent sample of people. By the way, that purpose of the study had nothing to do with drugs, but I'm using the data there to use it for my purposes. More importantly is that I found, like it says in the literature, there is a very strong association between if the parent is a substance user, is marijuana user, there's a 68% more chance, which is a significant statistical association, for that odds of that kid to use drug within that same family. Nice. More importantly is because I have data on these mothers before they became mothers, and I have data on a yearly basis, I have data how much they have used marijuana. For mothers that they have less than 12 months, 12 to 36 months, or more than 36 months before they became mother have they used marijuana. The more they used, the higher the significance of that association. So if they use marijuana for more than 36 months, this association goes to more than 333 times than compared to another child. And this is controlling for lots of variables: gender, family size, quality marital information, race, maternal intellectual level, socioeconomic status of the mothers, age of the delivery of the first child, lots of variables. Still, it holds true. So basically, I have a significant association between if the mother used drugs and the youth and their kids using drugs. It's significant. But my question is, there's lots of data that talks about disorders. If the mother has a substance use disorder, the child is more genetically prone to have substance use disorder. I don't care about that. I want to know what explained that child's initiation for the first time to taking up this substance and using it. Is it role modeling from the parents? Is it the availability of the substance on the family? Or is it another environmental factor that exists within the family? So I have data on parenting skills, and I thought, let's play around with this data. Factor analysis is a process. Instead of looking at every single variables that I have in my data set, a question about monitoring, a question about supervision, a question about this, I can cluster several questions that measuring this latent construct together, right? And instead of looking at every single measure, I pull in information from different questions into one construct, and I use this construct to proceed. And I have information, for example, on monitoring, on respectful relationship that comes from the kid, for example, whether or not he has a positive relation with the mother, and from the mother as well from an interview himself when he's doing the interview. And accordingly, I could generate 3 basic parenting variables: connectedness and bonding, respectful relationship, rule settings and disciplines. 3 important family characteristics that I want to see how they play around within this family. So again, I looked at maternal substance use. If mothers uses marijuana, and I looked at the parenting faculties, connectedness and bonding, respectful relationship, rule setting and bonding, lo and behold, there's a very significant association. Parents who use drugs, who marijuana use, have poorer parental faculties. Connectedness and bonding did not prove to be statistically significant, but still I kept it because this is something I would like to see how it play around later on. So there is this association between parents and parenting skills. Substance use have poorer parenting skills. The other element of the story is like, okay, parenting skills, how do they affect marijuana use in their kids? And again, I looked at these 3 constructs. And again, there's a very strong, significant association between every single one of these parenting faculties and the risk of initiation among substance use together. It was like, great. So how do these things come together? How much can parenting skill explain that association that exists between mothers who use drugs and kids? So I had that association that was significant. And I found that maternal marijuana use affect these parenting difficulties. And at the same time, these parenting difficulties increase the youth marijuana use. If that association dissipated, then these explain that relationship. And again, I found exactly that situation. That association that I found within this family was fully explained by parenting skills. What is more important is the fact that I can, using my analysis, every single one of these paths is an indirect path. So basically, mother to use marijuana to rule setting and discipline, to youth marijuana is an indirect path. There are 3 indirect paths. Each one of these indirect paths by itself was not significant. They were only significant when the 3 of them came together. And I was like, how powerful is that data? I'm looking at it from a perspective. If parenting skills within a family that substance use exist can prevent substance use, you can imagine how powerful that program would be on a universal basis. In a family, if you have strong parenting skills in a family that doesn't have that problem. That's 1. 2, in a family that uses drugs, a strong family skills program are important from a drug treatment perspective to include family skills program as part of the social integration program to prevent substance use in their kids. And 3, when we say parenting skills, it's not one thing. The 3 things have to work together. And it's a skill that needs to be developed. It's not something simple. And this is, it's not only having, enforcing strong monitoring. It's not only like, because it has to be linked with connectedness. There has to be something that Diana Baumrind has previously defined as an authoritative parent, not an authoritarian parent or a permissive parent. And that is a skill. How can you be an authoritative parent? And this is also adjusted for a bunch of things. And I wrote down my conclusions so I don't forget everything. So yes, parenting can play a significant role in substance use initiation. It can attenuate risk within the families. It's parenting skill, which is a skill. It's usable at the universal and selective basis. But most importantly, none of these skills I'm talking about is discussing drug issues. And this is the same thing that Professor Callum was talking about. This is a prevention intervention that does not incur that parents discuss drugs or talk about drugs, or like in the school to discuss drugs or talk about drugs. There are things related to the vulnerability that exists in the family, if addressed, can prevent substance use. And this is wealthy. Lo and behold, several years later, I got a job with UNODC coordinating family skills program, and I will tell you what we're doing in this field after this introduction. So we have the international standards on drug use prevention that I'm sure most of you are aware of, and many of you contributed to actually. We have a compilation of all the different family skills programs that exist. That's the orange book that you see there. It's available online. These are families that are a program that exists on a universal basis, selective basis, indicated basis, and for different age groups, families. And we have a guide to implement family skills program that exists. This is a short slide that describes the international standards in one shot. But you can see that family skills, the parenting skills, you see like the number of stars that exist, and the color is green because it's universal, or yellow, which is selective, and it has very strong evidence behind it. But it's a component within a larger system of intervention that exists. The prevention standards, the main message that it targets is moving away from informational knowledge that David was talking about into something that addresses the core vulnerability that exists, that leads to that uninformed choice or sometimes imposed choice for kids to use substances. So how effective are family skills? Based on the information that you can find in terms of the evidence, so every single evidence-based program that exists, you will see the following. That family skills, when you address that core component within the family, does not only help in substance use prevention. We're not discussing drugs, we're addressing a vulnerability. That vulnerability is linked to so many different things. We as UNODC are interested in substance use prevention, which is, of course, it exists. But while doing the same program, you also have an effect on violence. Sorry. You have an effect on violence, violence between parents, aggression between parents, violence between parents and children, and conduct disorder within schools. Physical and mental health can be improved both at the parental level as well as at the kids level within schools. Educational attainment can be improved and reduced of improved scholastic attendance. These programs can improve risky sexual behavior, but just by improving communication between parents and kids about sensitive issue. Occupational health can be improved. You can imagine whenever you have a good functioning family, your process of working at work can improve as well. Engagement in the community is improved. It moderates poverty. Even if you are living in poverty, in a very miserable environment, good parenting skills could be preventive measures within that society while the process of poverty is being tackled. It has a generational effect. So there are lots of studies that show that kids that were exposed to family skills programs, they grow up to be good parents themselves that will lead preventing substance use not only in them as generation one, but also in their kids. And this is also complements what Professor Foxcroft was talking about in his presentation, because economics could put a dollar value on cost effectiveness of measures, but there are 10 to 1 at least. But there are lots of these outcomes where you cannot put a dollar value to it and has a direct impact for you as a community. UNODC has been promoting SAP 10 to 14 as one of the programs, example from the compilation that has been described, strengthening the family 10 to 14 in several countries. And Families and Schools Together is another program. The only difference between the two programs is one addresses families that have early adolescent kids, 10 to 14. The other program addresses kids that are between the age of 4 to 7, which is a critical age of going into school in several countries. And you can see the diversity of implementation of these programs. We have reached more than 16,000 family members so far. About 5,000 families have been reached since 2010. We are celebrating the 5-year anniversary of this program. So basically about 1,000 families a year is being reached so far, thanks to the contribution of our donors, again, I have to say. And then we have over 1,000 facilitators. These are people that can engage with these families, that can converse in the languages of both FAST and SRP 10 to 14. And nationally speaking, we have trainers of facilitators that have been trained. All the work is being done with the governmental counterparts, with the Ministries of Education and Health, in order to ensure sustainability of these processes. The programs is not only used on a universal basis. Am I good on time? Yeah, no? I'm almost done. So basically in Guatemala, they're using it on a universal basis. They're using it for parents that are in recovery. Honduras for violence prevention purposes. Southeast Europe on a universal basis. I'll show you like some of these results. Families and Schools Together in Central Asia is showing effect on all of these parental faculties, cohesion, conflict, relationship, and you can see how these would bridge into several health outcomes in the future. This is one program. Another program is, this is SAP 10 to 14, showing results among parents. These are Montenegro, Dominican in yellow, Dominican Republic in blue, Guatemala in green, in brown, and green you have Honduras. I just want to show, and these are showing effect on violence, on rule setting, on family bonding, and family skills. The reason why violence is being very strongly, positively improved in Honduras is the fact that they've implemented these programs in violent communities, and this is another added value of such a program. The results are echoing the parents' results among youth when assessed from a different perspective. And this is fast in other countries, in Iran, by the way, 2 different settings in Iran. One is a lower socioeconomic status and one is a higher socioeconomic status. The orange is the lower socioeconomic status strata. Brazil and Uzbekistan as well, showing improvement of these results. We have published all of these results in several peer-reviewed journals. This is a view, but you can access them and we can share them with you. This is one of them on Central Asia. This is one where we talked about specifically the impact of violence. This is where we talked about the perception and beliefs about that after a 1.5-year follow-up of these parents, how long the program still had an impact on family functioning in Panama. So there's high political endorsement of these programs. There's a strong affinity to these programs to grow. We compared these programs to their original format In the United States, the data is moving in the right direction. This is a slide from the Dominican Republic showing that affinity directly. This is a family going under the range just to attend one of the sessions of family skills there. It speaks by itself. Acknowledgement, First Lady of Panama. This is the President of Honduras actually graduating the families of family skills himself with the First Lady. Future directions, we want to expand these work in these countries and add, fast wherever SAP 10 to 14 is, and SAP 10 to 14 wherever fast is, to have a complementarity of these programs. Consolidating effort for sustainability. We're independently evaluating this program as well. We're trying to run a randomized clinical trial in Panama, and we're doing this with the University of Manchester. This is the plan for 2016 and on. And with the help of USINL, we're trying to develop an open source program for families living in low resource settings as well. I would like to acknowledge my colleagues that contributed to this program, specifically Miloš. Miloš, where are you? Miloš is there. If you want any question for Southeast Europe, Miloš is our person there. Melva Ramirez. Melva is there back there. Melva is for Central America. And Borikan for Central Asia. These are my counterparts, including my PTRS colleagues that help a lot, the people that develop family skills, and the researchers that help on this process. And for any further questions, my email is listed.